Jonas Salk, an important figure of the 20th century, created a polio vaccine that would save thousands. In 1955, amid the Civil Rights Movement, War on Communism, and aftermath of the Korean War, a batch of polio vaccines contaminated with live virus caused the infection of 260 children and 11 deaths. This disaster, the Qatar incident, illustrates tragedy in nationwide vaccine campaigns and draws ethical questions. This incident led to the mistrust of vaccines and exposed issues in vaccine manufacture and public health policy. The Qatar incident was a turning point in public health and led to needed reforms in vaccine manufacture and regulation, and is a reminder of what happens when safety measures are inadequate. The earliest recorded instance of polio is from a 3,000-year-old stone tablet depicting a man with an atrophied limb, showing the far-reaching effects of the ancient disease in human history. Polio is spread through contact with fecal material, food and water contamination, and lack of sanitation. Consequences include paralysis and death. Instances of polio paralysis are small compared with populations infected. Symptoms are nausea, sore throat, drowsiness, and vomiting. Since polio is an intestinal infection, 72% of cases do not have symptoms. Polio is called paralysis of the morning, from cases where healthy children go to sleep, contract a fever during the night, and have onset of paralysis by morning. Polio epidemics are a modern phenomenon, with the first U.S. epidemic in Rutland, Vermont in 1894. This was studied by Dr. Charles Caverly, who found that polio could produce epidemics and that there was one mild virus that did not lead to paralysis. The earliest polio vaccine efforts were by Colmer and Brodie. Approximately 7,000 children were inoculated with Brodie's vaccine alone. The results were distressing. 10 children were paralyzed and 5 died from Colmer's vaccine. 2 children had polio within weeks of Brodie's. Both vaccines ended, and renewal in polio vaccine research was largely untouched until Salk nearly 20 years later. Jonas Salk was born in 1914 in Manhattan. He was an innovative, determined student and never saw himself as a great inventor. When a reporter mentioned patenting his vaccine, he replied, "Can you patent the sun?" In 1934, Jonas enrolled in New York University Medical School. He was a research assistant for R. Keith Cannon, researching strep bacteria, showing potential in microbiology. An influential figure in Salk's career was Dr. Thomas Francis Jr., under whom Salk found a passion for scientific research outside medical practice. Francis invited Salk to work in Ann Arbor, Michigan on influenza vaccine research, giving Salk skills for his polio vaccine. In 1947, Salk began working at William S. McElroy Institute in Pittsburgh, where he researched immunology. Before Salk's polio research, David Bodian discovered that there were 3 strains of poliovirus. Salk chose the dangerous Mahoney strain. Polioviruses from humans were injected into rhesus monkeys' brains, and tissues were harvested to create vaccine serums to protect against all 3 strains. The tissue cultures used were kidney, skin, and muscle, since nervous tissue could lead to inflammation of the spinal cord and brain. Salk's vaccine depended on formaldehyde to kill viruses, like Brodie's early vaccine. Salk developed a controversial straight-line theory for inactivation. He theorized the numbers of viruses dropped along a straight line by the numbers of days they were in formaldehyde. He determined the viruses were killed after 10 days. The first vaccine test subjects were children at the D.T. Watson Home for Crippled Children. The results were discouraging. Only one vaccine resulted in polio antibodies. Salk turned to a trial at the Polk State School for Mentally Retarded Boys and discovered the vaccine was effective after many dilutions. The press discovered Salk's work in 1953, and he feared that his vaccine would not be ready to meet public demand. Salk became a public hero to the criticism of other scientists. The field trial began on April 26, 1954, one of the first nationwide vaccine trials, with 420,000 children inoculated in schools and churches with Salk's vaccine, a placebo, or nothing. After much apprehension, the results came in. Salk's vaccine worked, and no children had contracted polio from the vaccine yet. The observation period extended into the winter of 1954, and the final evaluation was on April 12, 1955. Dr. Francis, one of the evaluators, was first to deliver results. The poliomyelitis vaccination was 68% effective against polio type 1, 100% effective against type 2, and 92% effective against type 3. It is safe, effective, and potent. People everywhere celebrated as if war had ended, but for Salk, the real war had just begun. Following Salk's vaccine, a future safe from polio seemed a reality. One survivor, Leonard Kriegel, wrote in his autobiography, The Long Walk Home, I just lay in bed, an 11-year-old boy who was terrified of the sick deadness that was creeping up from his ankles, before it crept on to devour my heart, my neck, my head, even my mind. The vaccine effectiveness is evident in a report from the LA County Health Index. From July 1955 to July 1961, the number of cases dropped from 273 to 65. but elation would turn to sorrow as unexpected results began trickling in. Cutter Labs in Berkeley, California, is a tragic example of what happens when quality control and regulatory agency guidelines are not up to par. Following an outbreak of polio cases linked to the vaccine producers, Sharp, Dome, Eli Lilly, Cutter, Wyeth, and Park Davis met to discuss problems. Common issues were gaining varying results when using different methods of tissue culture safety tests and the large scale of production. In smaller amounts, it was easy to inactivate the virus. In large amounts, activation rates changed, making government-mandated periods of inactivation inadequate. The dangerous Mahoney strain chosen by Salk to produce effective vaccines paved the way for problems. Problems unique to Cutter included filtration to remove cell parts that the virus was grown in. Remaining cells could lead to live virus in vaccines. Too long a refrigeration time allowed these cell fragments to collect in samples. Safety tests were spotty, especially in tests on monkeys used in vaccine production. Another problem was safety inside the building, with Cutter housing the live and inactivated virus vaccines in the same facilities. The most glaring error was the failure to continue exploring the time needed to inactivate the virus. Cutter Labs disregarded this crucial step, leading to disaster for Cutter and fear of safe vaccines from other companies. The spreading fear was well-founded. Vaccines produced by Cutter Labs have been distributed in 18 states to thousands of children. States banned the use of Cutter vaccine and called for an investigation. When Salk received the news, 29 cases had been reported. At the end of investigations, there were 11 deaths. 29 individuals contracted polio directly from the vaccine, and 105 contracted polio after coming into contact with someone infected by the vaccine. The Surgeon General, Leonard Scheel, ordered all Cutter vaccines to be removed April 27, 1955. Vaccine production was postponed until investigation concluded. Scheel was blamed for a lack of transparency during the investigation, as well as Oveta Kolpabi, Secretary of the Department of Health, Education, and Welfare, who authorized licenses for vaccine distribution. Critics blamed government failure to regulate vaccine safety and rush into vaccine production. Salk became the scapegoat and would forever feel responsible for the tragedy. Supporters of the vaccine scrambled to restore public faith. A 1955 Gallup poll revealed that only 36% of people still wanted to be vaccinated. The real victims were the children who contracted polio, to be paralyzed, confined to iron lungs, or even face death. But there was hope for survivors. As Dr. Laura S. Halstead, a doctor and polio survivor, relates, after emotional recovery from the shock of the initial illness, there follows a period of medical recovery that permits most patients to make some functional gains, in many instances spectacular recoveries. A new organization was created, the Poliomyelitis Surveillance Unit of the Communicable Disease Center, important in investigations. The National Institute of Health, the Public Health Service, and the Department of Health, Education, and Welfare met to find solutions. Lawsuits came flooding from victims seeking restitution. In July 1955, Hobby resigned, followed by her assistant, Chester Kiefer, and the director of the National Institute of Health, William Sebrill. The Bureau of Biologics took a more active role in vaccine testing and created a division for polio vaccine safety in 1956. The CDC, formerly the Communicable Disease Center, grew more influential and began to actively track epidemics, becoming an important source of information. The National Foundation for Infantile Paralysis was eclipsed by the federal government in polio vaccination, which took a larger role in vaccine regulation to ensure tragedy prevention. Amid receding waves of outrage, Albert Sabin was working on a live virus polio vaccine. It began in 1951, and research took off in 1956. Sabin's vaccine would replace Salk's, due in part to the Cutter incident. Benefits of Sabin's vaccine included oral administration, few supplies needed for vaccinations, and fast antibody production. The impact of the decisions of the Cutter incident court cases set an important precedent. Pharmaceutical companies were now liable for damages created by products, even if production was not at fault. The principle of liability without negligence. This set high standards for companies to take strict safety standards for the well-being of the public and company. Changes in production and regulation occurred. In the 1970s, the FDA regulated vaccines instead of the National Institutes of Health. The national government implemented difficult licensing procedures. Storage and testing of vaccines improved, and the public grew to trust vaccination. The U.S. government continued increasing vaccination, seen in the 1994 Vaccines for Children program, ensuring all have access. One crucial fact cannot be denied: the Salk vaccine provided a key step in the fight against polio, saving thousands. In the U.S., after the 1956 vaccine release, the numbers of cases of polio decreased 50%. Today, polio is nearly eradicated worldwide. It is necessary to remember those whose lives were lost in the Cutter incident. It serves as a powerful reminder of the danger of medical trials and lack of adequate safety standards to prevent future tragedies from occurring.